I request Dr. Krishna Prasad to speak on communication pearls in cataract surgery.
So, cataract surgery is our bread and butter, obviously. It's the most commonly done surgery across all surgical specialties in medicine. So, you need to really know exactly what you tell to a patient so that we have a good practice, happy patients, and, probably the doctor-patient relationship continues to foster better. So basically, as Dr. Manohar was alluding, that it's a forgotten skill and there is no actually curriculum in our medical practice, our training to become good communicators. So it's found that the good communicators always get into less trouble. And obviously, whatever surgery that you do, how much ever you train yourself to get better at cataract surgery, it's actually the miscommunication and the lapses in communication which actually takes away the value from it. If you are a good communicator, probably you have happier patients and they can also make up for small lapses in your quality of surgery. Coming to I'll just take two, three situations in day-to-day practice. A second eye syndrome. Whenever a patient comes for cataract surgery, he has a cataract in both eyes. The first surgery goes well, you do a topical phaco, patient is very happy, patient expected, a lot of trouble, but it went on very well, smooth, very quick, patient did not have any discomfort, and he's seeing very well post-operatively. So patient extremely is happy, so he comes for the second eye. But it's found that when the second eye happens, he finds that the second eye surgery took longer, the second eye surgery was painful, had a lot of discomfort compared to first, and he's not seeing that well compared to the first time. So why does that happen? Because the two evils of life, if you know that it's all about comparing and expecting. If you don't expect anything in life, you are usually happy. If you don't compare anything to anything, so then usually you are likely to be more happier. So these two evils are working in the second eye surgery. If you just analyze it properly, when the patient comes for the first eye, he only has fear. He has no idea about surgery. So now you deliver such a good surgery that he's extremely happy. Whereas he comes for the second eye, he always has an expectation. The expectation that this surgery will go quicker, painless, and he's going to see the moon. So this expectation load makes the second eye surgery actually less satisfying. This is the whole problem, because first eye has no expectation, second eye has. And comparing, the first eye surgery you do, he compares the vision. Probably it is an emmetrope for distance. He compares it to the cataract surgery, the vision of the other eye which has a cataract. Obviously, the first eye looks better. When he gets the second eye surgery done, he is comparing that vision to the first eye which is already operated. So it's an unfair comparison. So obviously, in comparison, he thinks the first eye probably surgery it went on well, and the second is a problem. So in order to solve this problem, you tell the patient beforehand, at least I do that, I tell the second eye will take a little longer, it will be having a little more discomfort, and it will get better slowly compared to the first eye, okay? So that at least patient do not actually misconstrue what you do. And obviously, this is something which is a forte of seniors, but even all the juniors should also learn how to break the bad news. Imagine you are in cataract, you are in the OT, there's a nucleus drop. You're planned for some premium IOL and you're not able to put it. So how do you break the bad news? See, normally you may have a long list of 20 cases. The second case, do you have a nucleus drop? So you obviously want to finish your list, make the patient sit and have a proper conversation explaining the pros and cons. Don't do that. I think the patient's area and time of vulnerability is the OT period when you are actually operating. Why does that happen? See, just imagine our patients see a lot of Bollywood movies. What's a typical OT in a Bollywood movie? So you have a closed door, you have a red light blinking, and patients are moving here and there. And after a period, the door opens, the OT door opens, and the surgeon comes out, sometimes not wearing, sometimes having a stethoscope, or not wearing a cap. So he comes out and delivers a judgment. He says, बच्चे को बचाना है, माँ को बचाना है, 24 घंटे में होश ना आया, some nonsensical judgmental thing which is going to be life-shattering. So our patients are tuned to hear to the bad news or some life-changing judgment at the time of the OT. They are mentally conditioned to do so. So you rather better call the patient relative at the junction of the semi-sterile and the normal area, and you go there with you all with a cap, mask and gown towering over him, and you say that we wanted to remove the cataract, the back surface, the support is not very good, so we have removed the cataract, but we have not put the intraocular lens, it will require some other procedure. So you tell something in whatever way you want to tell in the OT premises so that they are actually mentally tuned to hear the bad news. If you go after 4 hours, you go to the room and start discussing the whole thing, by then that period of vulnerability is gone. They are no more susceptible, so they are no more in that taking defensive position. So they would rather turn hostile, and probably they may use this. They may say that they did a surgery, they washed it up, and they don't have, he comes at the end of the day to come and tell me the news. He doesn't have the courtesy to actually tell me that something went wrong. So better you break the bad news then and there. And about multifocal, see, a very simplistic thing for juniors, if you patient, normally you do a multifocal or a trifocal, patient comes and complains of halos. You do a monofocal, patient says, chashma kyun de rahe ho? So rather, how do you actually strike a balance? Is you give a choice to the patient who can understand, do you want clarity or you want convenience? The clarity of a monofocal, you have to bear the small inconvenience of wearing glasses once in a while. If you want the convenience of totally spectacle independence, then probably, if you want a complete, spectacle independence, then obviously you need to wear glasses once in a while. Whereas if you want, complete clarity, then probably you need to, So this is a combination where the patient cannot come and complain later. If you has chosen trifocal and complains of glares, you say, no, you wanted the convenience, so small clarity has to be compromised, and vice versa. So this will probably put things in perspective, and also it will probably help us to simplify the whole jargon of this selection of trifocals versus monofocals. And obviously, I told you, we always sell our packages in the name of, in the garb of our lenses, Indian imported, that, this, not the surgical skills. I think we should start selling our surgical skills. Your surgical charges should be same for whatever the IOL that you are putting. And lastly, it's endophthalmitis. This is a very, very demoralizing situation for beginners. It's a disastrous consequence for the patient. So, but it's not end of the world. It calls for both art and science. So please accept, there is no task for you. Everything is endophthalmitis unless otherwise proved. Don't be in a denial, fall in line, and be very, very judicious and be energetic. So obviously for the patient, it's a complete, it's a very big loss. Patient critically analyzes your surgical skill. You may be a great surgeon. Patient says you are no good. I paid you money and you lost you botched up the surgery. So how do you do that? So don't wait. No, there's got a busy OPD patient. If somebody comes and tells that he was operated 3 days ago and he's lost vision immediately yesterday. So if you can know that, please call the patient immediately. Even if you delay for 10 minutes, you are seeing a VIP, he will say 2 hours I was waiting. He will start calculating from the time he left the house also. Say 2 hours I was waiting and he didn't care about this particular thing even after having this problem. And also make it private. Don't talk in front of others. Make it a private thing because they do have a lot of histrionics at that time. It may create a scene out there. See, you should be compassionate. At the same time, you don't have to really bend yourself backwards. You don't have to be in a panic mode and trying to show that you have done something wrong. Endophthalmitis happens. Okay, there's no criminal intention. So let us look at it scientifically. Don't worry what happens tomorrow. Don't forget about that. And ask the patient, when did it happen actually? Patient, you have done the surgery, patient will see immediately after surgery usually. The endophthalmitis takes some time to develop. Even if you introduce bacteria, it will take 2-3 days for the vitreous involvement and the vision to drop. So you make them clear that, did you see first day? Yes. Second day? Yes. Third day? Yes. It started in the evening. What happened during that time? Did you cough, sneeze? Did you rub the eyes? Something happened. Did you not put the drops properly? There was a mistake. You put the morning drops in the evening. You create some kind of a confusion about some contributory lapse from their side, which might be the reason. So once you say patient saw well for 3 days, that means your surgery must have gone well. If he's not seeing right from day one, then probably you are at fault. But if you are seen for first 3 days, maybe something else. Very important. As Dr. Manohar said, don't use the word infection. Infection, septic, pus, all that you have not probably washed your hands properly, reaction. Information is a reaction, and don't panic. Take the hostility head on, and this is very important. You be genuinely interested in the patient welfare, things will get better. See, obviously, you're in India, the litigations are not that great. If your communication is good, maybe you can sort out things much better. Finally, even though you may get, better to avoid a litigation because it takes away a lot of stress on your mental stress, you should be ready to, you should anticipate it and be prepared. That is very important. And very important is document. Hire a good lawyer, not necessarily your friend. Just like there are good cataract surgeons and bad cataract surgeons, there are good lawyers and bad lawyers. Choose the best lawyer, and most important, the law is a slave of evidence. Unless you have an evidence that you have done your autoclaving, you have documented it. Even if you autoclave 3 times and don't document, it doesn't make sense. So document everything, and you can always win in the court of law, but that is not really important. If you can communicate well to the patient and prevent such a situation, that will be the best case scenario. Thank you very much.
Thank you, Dr. KP, for that